So let us continue the Nash therapeutics study streak and the remedy which Dr. Nash mentions after opium, which is one of the best remedies for numbness of pain or lack of reaction, and something that comes out of the thoughts after thinking about this remedy is nothing but a similar remedy which is Nux moschata. So Dr. Nash speaks about Nux moschata in the next, remedy discussion in Leaders in Homeopathic Therapeutics, and let us go over it and find out what does he want to convey from this remedy. The first line he mentions that it is a very commonly used remedy, commonly found remedy in our kitchen and tables and everywhere, and this remedy has to be uh, very commonly seen, but it is also a powerful poison. And in homeopathy, how we use it, it all depends on how we see it in the provings and also in the clinical knowledge. So, myself, Dr. Alpeshoza, I'll be covering Nux moschata from Leaders in Homeopathic Therapeutics on this page, Homeo Setu, which is going to be your bridge between academic and clinical homeopathic knowledge. Nux moschata from Leaders in Homeopathic Therapeutics. Dr. Nash writes it affects the mind and the sensorium, and the stupor is there. There is insensibility, there is unconquerable sleep, there is vanishing of thought while talking, writing, reading, weakness or loss of memory, fitful mood changing from sorrow to frolicsome behavior, now grave, now gay, sometimes happy, sometimes very sad, absence of mind, cannot think, has to recollect his thoughts before he can answer simple questions. So he gives in the beginning itself that the remedy acts on the mind and the sensorium, the presence of mind, your act and activeness. That is where it acts. If you find a patient mumbling or trying to mumble jumble or trying to find answers to the questions you have asked, either from the recent history that you require or the old history, and he finds it confusing to answer, Nux moschata can be one of the remedies that can be taught. What Dr. Nash writes after the first few lines is very interesting. Sleepiness and dullness of Nux moschata equal that of opium. But there is a difference in pathophysiology. And if you understand the pathophysiology of each remedy, you're going to transform your homeopathic practice. In various remedies, Dr. Nash mentions how the remedy acts and why it has to show certain symptoms. In opium, it shows sleepiness and dullness due to fullness of the blood vessels and pressure. In Nux moschata, the sleepiness and dullness is shown by the benumbing of the nerve substance or the nervous system itself. So, if you understand this aspect, and whenever the patient presents the symptoms, you see whether it is the blood vessels that are affected or the nervous system, your job to prescribe Nux moschata or opium becomes easier. And then he gives the trio of sleepiness, which we all have been seeing various trios from Dr. Nash's therapeutics, which is Nux moschata, opium, and antimpart. All three remedies are indicated in bowel complaints of children, and more so, Nux moschata will have dryness of mouth. Mouth is so dry, the tongue sticks to the roof of the mouth, yet there is no thirst. Tongue, lips, throat, all are dry, and you see this also in other remedy, which is apis, pulse, and lachesis. But Nux moschata is very peculiar in many of its symptoms, and you'll have to decide based upon the physical generals which Dr. Nash gives. Flatulence of Nux moschata is explained by Dr. Nash going further, and he says that there is distension after meals. Another remedy which should be seriously thought of in such complaints that has distension after meals is Calibicromicum. So you will have patients who complain of gastric ulcer. You will have patients who complain of duodenal ulcer. There will be a gap of few minutes after eating that they have the complaints: pain in the abdomen, burning, uh, distress, distension. Those patients will require Calibicromicum or Nux moscata. There are other remedies also like anacardium, conium, and a few other remedies. But Dr. Nash over here in this discussion mentions very shortly about Nux moscata and Calibicromicum. Now, going further, Dr. Nash gives us a very beautiful case of typhoid fever where he saw that the symptoms were of a very stupid nature. The patient was mumbling, not conscious. There was yellow, watery diarrhea, and there was bloating of the abdomen and rumbling also, which could be felt by the physician or the patient. He has not mentioned it. But phosphoric acid was given and it did not help. He just examined the mouth of the patient. There was dryness. That's where he decided Nux moscata. Now tell me, if you miss examining the patient, if you miss examining, clinically examining the patient and you are prescribing a remedy and you are failing, then you are blaming homeopathy or you are staying in guilt. But you have not performed the necessary steps that are required for proper execution, which is a proper clinical examination. In Merksol, Dr. Nash writes about the wetness of tongue, the moist tongue, and in Nux Moscata he writes about dryness of the mouth. These are the minor observations which a homeopath needs to make. Once you make these observations and you make a habit of making these observations and check whether the pathophysiology and the patient symptoms all fall in place, you will surely succeed, my dear friends. After this case of Nux moscata, which he has mentioned, he gave 200 potency and he saw good result immediately. He also mentions once again that some cases which will not improve, we need to prescribe intercurrent remedies like sulfur, opium, lorocerasus, and sorinum. Then he goes on a beautiful comparison of Nux moscata with lot of remedies. For each symptom in Nux moscata, there are standing different remedies against it. For example, Apis mellifica also has sleepiness with Nux moscata. In Apis mellifica, it is interrupted by piercing screams, especially brain diseases. Again, in Nux moscata as well as in Camphora cannabis indica lachesis, there is vanishing of thought while talking, reading, writing. Then in Nux moscata and also other remedies like anacardium, lycobrannia, sulfur, natramur, loss of memory. Now, loss of memory is a very trivial symptom if all the other parameters, the nutritional deficiencies are correct and patient does not have any nutritional deficiency and you find this loss of memory, then you can think about these remedies. Also in nutritional deficiency, you can think about these remedies but try to fulfill them from the natural sources. It is going to help in the long term for the patient himself. In Nux moscata as well as in Aconite, Ignatia, Crocus sativus, Platina, there are fitful changing moods and disposition. This will be the case of many female patients. You need to think about these remedies very strongly. Again, in Nux moscata, and there are remedies like anacardium, creosote, lachesis, natramur, and merksol, absence of mind, which is mentioned. There is a very fine line of difference between absent-mindedness, between absorbed, buried in thought, between abstraction of mind, between confusion of mind, and confounding objects and ideas. So if you are on this page, Homeosetu, and if you are following all through the past few months and going further, you will be getting some important information about how you can differentiate the different rubrics going forward in your practice. So stay tuned, stay connected. on YouTube, on Instagram, on Facebook, or whatever social media channel that you see Homeo Setu. Now, Dr. Nash, going further, he mentions that all the remedies that are similar to Nux mosquito, they will have hysteria 110%. And Nux mosquito is a remedy which is for all the hydra-headed complaints. A wide variety of complaints, and Nux mosquito will be indicated. So that's all from me, Dr. Alpesh Oza from Homeo Setu, and we are coming up with something interesting very soon. Stay connected and subscribe to the page to learn a revolutionary way of resolving your cases and transforming your homeopathic practice.